go.
Okay, so this branch here is the external iliac coming from the bottommost of the abdominal aorta. Then the first branch we have off is the deep femoral, I think.
Yes.
And it's really short. So like just this section here is deep femoral. Then we have a division, goes into a Y. Then we have the upper portion here, which goes into the abdominal muscles. That's the pudendal epigastric. And you can see that that one branches right away here. There's one, and then the other one is right there. And then we have the other branch here, which is not the pudendal epigastric, it's the
medial circumflex femoral.
Yeah. And then going back to the
Still the external iliac, yeah.
We have a little bit of a mutated one here, as always. It's supposed to be the lateral circumflex femoral. That one?
Yeah, lateral circumflex femoral.
Okay, so we have two branches coming off individually, but sometimes in the normal case they're kind of fused and they come off as one branch and then split. So we just have like an early split kind of thing. Then we go down a bit more, and we have the proximal caudal femoral. And then we have another branch that we need to know. Travel down a bit more, and we get this one here, which is the most superficial one. And it goes downwards, continuing with the leg. That's the saphenous artery, and it's right next to the saphenous nerve and the saphenous vein. On the opposite side, but still somewhat superficial, is the descending genicular, something like that.
Yeah.
And then we have the continuation of the external iliac with another branch here, going caudally into the muscle. This one here is the middle caudal femoral. And then from there we have the external iliac, which gets really deep. We have to pop it open. And we go down far enough. I don't know if you can see it in the video, but right here, there's a branch. Wait, hold on, I'll move the... So we have the continuation here, and then right here. Can you see into it?
Can you lift it up a little more? Not really, because it's dark.
Yeah. Okay, well you can see it, there's one there.
Oh yeah, you can kind of see it now.
So the one that's going this way, that's going that way, is the
distal
caudal
femoral, yeah.
And then at this point, it's no longer the external iliac, it becomes the popliteal. So now everything from here downwards is the popliteal, and it goes deep into the muscle and comes around and through here, and it wraps around.
You know what?
And it wraps around and behind the bone, and when it emerges on this side, it becomes the
cranial tibial.
Cranial tibial, yeah. And then it just continues along here. So there it is. And then we have some other random branches, but
yep,
it's all that.
Okay, now nerves. No, it's fine. Just keep it going. I know. Okay.
So we'll
back here.
So we have this big thing here, which is the like farther out part of the femoral nerve, which starts at one of the lumbar spines.
Yep.
And then off of that, we have the
Saphenous?
Saphenous, yeah, that's it. Too many S's.
Yep.
So we have the saphenous nerve that just runs along here, and then once it gets down around the knee area, a little bit past it, it splits into a Y.
Use your imagination.
Yeah.
Okay.
Obturator
Operator.
is here. And that also goes back to the lumbar
Region.
Yeah. And then wasn't there another one? Or was it just the
That was, and then there's nope, and then we go to sciatic.
Oh yeah.
So the sciatic.
Which also comes from the lumbar spines. So
It's under biceps femoris.
and it's pretty big. So have all of that in there is the cephalic.
Sciatic.
Sciatic, yeah. And then it splits off. So we have the smaller one.
And superficial.
Yeah, and it wraps around the other muscles and goes down, and that one is the fibular.
Common fibular, yeah.
And then the other thicker one that we did not cut, that goes deeper into the leg muscles, is the tibial. Common tibial?
Just tibial.
Just tibial.
Yeah. Okay.